You're listening to the Quint's podcast.
A coastal state famous for its beaches, floating casinos, crowds of tourists, and a mixed bag of international cuisine and culture, Goa is currently facing a deadly spike in COVID cases, which is ripping apart the entire state. While it's been racking up more than 3,000 cases every day since the uptick began in April, on 14th May, the state hit a record high positivity rate of 51.4%, the highest in the country. For a small state with a population of 1.5 million, the sudden spike in cases mean that the healthcare facilities are beyond overwhelmed in Goa. While the total cases as of 19 May is at 23,956, Goa has less than 2,300 hospital beds in only 26 hospitals. Moreover, according to government data, Goa along with Delhi have reported the highest deaths per 1 lakh population. In fact, in Goa, several of the deaths have come from its biggest COVID center, which is the Goa Medical College and Hospital. This 1,200-bed hospital has reported more than 75 deaths between 10th and 13th May, with less than 1 lakh people being completely vaccinated in the state since inoculations began in January 2021, and a tenfold rise in COVID cases just within a month, and reports of oxygen shortages in hospitals. How did Goa arrive at this terrible crisis? Who is to blame for Goa's condition? In this episode, we will try to bring out the ground reality of healthcare facilities and analyze the actions taken by the state government on the crisis. To help me navigate and understand Goa's crisis, I spoke with Dr. Lenny Da Costa, a resident geriatrics physician and a functional medicine expert in Goa, Shruti Chaturvedi, an entrepreneur and the founding member of the COVID Goa Care Volunteer Group, and Sujay Gupta, a senior journalist and a consulting editor for the Herald in Goa. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you, and I'm your host, Himmat. Just in the period starting from April, where in a span of just 1 month, the daily case count went from 265 on 1st April to 3,024 on 30th April. At its peak, which was on 7th May, Goa reported 4,195 cases in 24 hours. But how does a small state explode like that with COVID? We all know Goa as a tourism hotspot, famous for its beaches. A tourism hotspot that has been open for all, even as its neighboring states Maharashtra and Karnataka's COVID numbers were shooting up. According to Dr. Costa, the state tackled the first wave very well by putting timely restrictions in place, mandatory RT-PCR test, and the health system, though running on capacity, were not severely overburdened with the COVID cases. However, the state government lifted its foot off the brake too early. Goa's engines are powered by tourism, and as cases subsided across the country in September last year, hotels and resorts in Goa started advertising lockdown packages to cash in those wanting a quick escape from their locked existence in metros like Mumbai, Delhi, and Bengaluru, cities which were still battling the virus. In my conversation with Dr. Costa, he mentioned that even though the state does have enough healthcare facilities to cater to its own population and the floating tourist population, the state government ignored the possibility of a second wave and broke down the COVID care centers which were built to counter the spike in cases.
Okay, so let me start by saying when I was a student about 30 years ago at the Goa Medical College, we had in our preventive and social medicine uh, targets for health for all by 2000. That was for the entire country. And in 87, 88, or 89, Goa had already surpassed all the targets that were meant for the year 2000, about 11, a decade before the rest of the country did. So our health infrastructure has been pretty good. It might not have been the best. It might not have been very elaborate, but it was good enough to give basic health care to everyone. Uh, we also have a huge population which is quite literate, so that becomes quite easy. Now, having said that, we also have a huge infrastructure today of the tourism industry. I mean, our tourism is like massive. We have as much of a visiting population or a circulating population which comes in and gets out of Goa, which is as much as the resident population. So besides this, we have a lot of people who have second homes in Goa. Now, a lot of the health infrastructure has not caught on with that, though we are quite well advanced. We've got a medical college hospital which can boast of everything under the sun that it has. We've got good private care setups which can boast of advanced healthcare in the state. Plus, around Goa, we've got a lot of other healthcare facilities available. So generally, our healthcare facilities are quite robust. We have had a very good system. Besides which, the so-called rural healthcare is well connected. I mean, you see, many of our rural areas are not really rural as you see in the rest of the country. They are kind of urban rural kind of setup. Where you have the more affluent living there. So even the rural healthcare facilities, like the rural healthcare centers of the government, are pretty well set up. Now, over the years, they may not have been maintained as well, but the network is quite well established. So, in the first wave, we were well prepared. I guess we did our homework well. It was a very nice effort from the government, the private sector. Everyone joined hands, and we really did ride the first wave very easily, as you could say, as I could say, because a lot of the people got. In fact, I got my COVID much after the first wave was already on its decline. Uh, but having said that, I think we celebrated too early. We opened up very fast. Uh, there was no thought, strategy, or a plan B in place when we opened up. In fact, our New Year's celebrations in Goa looked like there was no COVID at all. I mean, if you see some of the photographs, you'll be amazed. Okay, there was no all our casinos were going full blast still, even way into the second wave. We were not even bothered, and we didn't have any kind of strategy in place where we could have gone about taking care of a sudden spurt in cases. We didn't have any strategy, none absolutely, and no thought in the fact that our healthcare system can get overwhelmed. So what basically happened was, because of this kind of an open and everything seemed normal. You see, people were very slow. But having said this, we didn't have a plan B at all in place. It was so sad. Okay, and then when it finally started off, all the hospitals started getting overwhelmed. In fact, we had dismantled some of our COVID care centers, thinking we won't require it. And now to put it back, we don't even have setups ready. And the setups are coming in so slowly because there is no supply of beds. There's no supply. See, I'm trying to get beds. We are not getting beds. I'm trying to get mattresses. We're not getting mattresses. We are trying to get concentrators. We're not. I mean, this is my personal experience. We are not getting concentrators. Cylinders have been a struggle to get. I've managed to get some in Bombay yesterday. So it is challenging to get ordinary supplies. You won't believe it. My clinic, which does a lot of IV work because we have a daycare center for the elderly, my regular supplier could not supply me IV sets. An IV set that costs you 10, 15, or 20 rupees in the wholesale market for hospitals, we couldn't get that. Any kind of oximeters, we didn't have oximeters. That is something that everybody needs. Pulse oximeters are not available. People were selling me 400 rupees equipment for 1,500, 2,500. Somebody even offered 6,000 rupees for a flow meter, which generally costs about 2,500. And that is sad. And this is all because we were not ready. We were just not ready. Nothing was planned. Nothing was planned. We were at sea when this thing happened.
Now, a lot of criticism is being directed at the state government for not taking the second wave seriously from a very early state. The state government, where the BJP is currently in power, is being led by Chief Minister Pramod Sawant. It was only on 9th May that the state government imposed a statewide curfew when infections saw an over 10-fold rise in a month, and it was only after COVID deaths started increasing is when the government started scrambling to contain the virus. Between 4 to 10th May, Goa recorded 389 deaths due to COVID, with the highest daily death count of 75. Of these 75 deaths, 26 died at the state-run Goa Medical College and Hospital in the middle of the night due to a suspected shortfall in oxygen supply. While the Health Minister Vishwajit Rane attributed the COVID deaths due to an oxygen shortage in the state, the Chief Minister claimed that there was adequate oxygen, but it was not well distributed. According to Govt, a senior journalist and a consulting editor for the Herald in Goa, The state government ignored the elephant in the room, and there is a lack of checks in regards to the oxygen being supplied to the hospitals.
What has happened is over the and coming quickly to this pandemic, what people are seeing now is a marked degree of insensitivity, and in the sense that they see it in front of them, and I don't think they're actually realizing the troubles that people are facing, the injustices that they are facing, the absolute apathy in terms of the treatment and facilities and so on and so forth. It is just that they can turn around and say that we've been completely overwhelmed with this whole pandemic, and we never felt this. It will be so huge in terms of its scale and its disastrous effects. But the counter question to that, and rightfully so, is that look, at the end of the day, every state and other major countries, there was some amount of planning. But Goa, instead of planning, actually opened up its doors and made Goa more accessible to the outside world. So the irony was that people from red zone states were merrily coming to Goa to live, work, and so on and so forth. Whereas and ultimately that had a very bad after effect. Goa has been kind of living in absolute denial for the last 3 to 4 months, and then it suddenly sees the elephant was always in the room, and Goa refused to see it till that elephant started killing people. And then when people started dying, they started seeing the elephant in the room. And see, also what has happened is, now if you look at oxygen, now can we really say there was an oxygen shortage? Yes, but again, you need to look at the background. You see, earlier on, there was one major oxygen supplier who used to supply oxygen to the government hospitals and others, and that company did a very good job. The current health minister, what he did was the current health department and the minister got into a contract with another company called Scoop Oxygen. Okay, now if you look at a lot of investigations in certain local papers, there are serious allegations of absolute corruption, where the tender was loaded completely in favor of Scoop. And these are, I'm now not saying this independently. I'm just quoting from publications that have reported this. So I will still say alleged, but at the end of the day, it's right out there. And as the story goes, we there's been no kind of accountability on the delivery systems of this particular oxygen supplier. There was no audit on whether the oxygen cylinders that were coming in to GMC, were they full, or were they half empty, were they delivered on time. So my point is, if the government is the buyer, it needs to have checks and balances as a buyer, to check everything that's coming in. I do not think the goods that were coming in were ever kind of checked and verified. So at the end of the day, they did not really, instead of augmenting services, they actually dumbed down, which is shocking. And then this whole ecosystem of opening up Goa, letting everybody come in without RT-PCR checks and so on and so forth. Even now, after cases surged, the government was all along telling the court that there is no justification. Even after the court pulled up the Goa government rather, and told them, how can you not have RT-PCR checks? Now, in the affidavit that they filed, they actually said, there are a lot of people who filed PILs on why Goa was not insisting on RT-PCR tests. And in response to that PIL, the Goa government filed an affidavit. And one of the lines in that affidavit, I'll just quote from the affidavit. And the person who signed the affidavit, the health officer, he says, I say that the condition of carrying a COVID-19 certificate may not be feasible in the present situation. This line was written after Goa witnessed 50 to 60 deaths on a daily basis. Of and you see, and this is an affidavit telling the court that, look, hey, don't insist on everybody carrying the RT-PCR certificate. So it is completely shocking. Even after the court said you need to make the RT-PCR negative certificate for all entrants to the Goa government passes an order where they expand the whole scope, and they said, you need to get a RT-PCR certificate, or if you can show whether that you're coming for work, or if you're vaccinated. So my point is, anybody can say he's coming for work, and so basically they were paying lip service to the court order, and essentially doing the same thing, letting everybody come in. So the court had to finally step in again and say, hey, please amend that order. So the court had, even after passing the order that the government should make RT-PCR certificates, negative certificates compulsory, had to step in again to modify the order that the two collectors passed, where they actually dumbed down the spirit of the court's order. So you just see, there seems to be this constant kind of a battle between an errant child and a parent, with the court being the parent and the government being an errant child. It's not even responsibility. It's they were just being completely precautious. They're acting like children.
Mr. Gupta added that the biggest error by the state government is, and I quote, a deliberate callousness of turning a blind eye to the possibility of a second wave, end quote. He further stated that there were no systems which were put in place to fight a future wave, and health facilities were actually scaled down.
The biggest error, I won't even call it a lack of judgment. I would say this, that this was deliberate callousness of, firstly, turning a blind eye to the possibility of the second wave. Point number one. Point number two, essentially, instead of scaling up health facilities, they actually scale down health facilities. Number three, the rural and the primary healthcare center is vast. There is infrastructure there. That infrastructure was not augmented, as a result of which everybody was just rushing madly towards just one medical college for government healthcare. And of course, there's one in South Goa as well. But I think this whole madness stemmed from there. Number three. So number four, there was no communication done, and there was absolute lack of communication between people and the government on steps that the government needs to take, to see to it that there's a proper vaccination drive, the proper precautions, information as to where they can go and get tested. Even the testing facilities were not as augmented as one should have. So what I'm essentially saying is that on each of these factors, and then also what happened was they did not even realize that people would fall so sick that oxygen supplies would be so critical, and the need to set up oxygen plants. Another important point, the issue is that there were proposals to set up oxygen plants, many oxygen plants in many of the hospitals. Not one of that was implemented. It is only after the court intervened that on the 11th of this month, in the affidavit, they actually said that a liquid oxygen tank facility of 20,000 liters has already been installed in the Goa Medical College. Now that was, for the lack of a better word, a lie, because it is on the 16th, 3 days later, the health minister tweets that I have just inspected the facilities for putting up the liquid oxygen tank, which means that 3 days after they give an affidavit in court, the inspection for installing that the 20,000 liter oxygen tank happens, which is as late as the 16th, on the 16th of May, when your death number of people who've died was shot up to over 18, 1900, 2000. So I'm essentially saying that this is something that needs to be really, really seriously kind of looked at, and people must be made accountable for this. And then, of course, one more reason, I'm on the same breath, the constant power play going on between the health minister and the chief minister. To be fair to the health minister in this case, he was the first one who always called for an absolute lockdown. He's the one who, in an interview to CNN International, actually said that it was an error of judgment. He said it was an error of judgment, and I think that was probably one of the few honest lines coming out of the government in the recent past. But my point is, when an error of judgment costs you so many lives, it is not a small error. It borders on criminality. If this is what you do, and you lose so many lives, then there has to be an accountability beyond an expression of regret.
Clearly, the state government was missing in action in the initial days of the spike, and the system was overwhelmed with the surge in cases. But what is the situation now? Has the government pulled up its socks yet? According to Shruti Chaturvedi, who is part of the COVID Care Goa volunteers group, there is not even a channel of communication between the government authorities and the local citizens, as COVID helpline numbers are always busy or not functioning. I spoke to Shruti on what is the ground reality and the challenges faced by the citizens in Goa, and she provided an extensive list of the same, which shows how fragile the healthcare system and the government structures are currently in Goa.
So one is the accessibility of the system. That is a big problem. Like everything you want to get through in Goa. Like अभी जैसे आपका एक हेल्पलाइन नंबर था 104, and when we started COVID Care Goa, उस दिन मैंने 104 को at least I would have tried calling 10 times and the number would not get through. 108, अगर आप एम्बुलेंस बुलाते हो तो आपको 6 से 7 घंटे का आपका टर्न अराउंड टाइम होता है एम्बुलेंस के आने का. So by the time the patient is already severe, and in all unfortunate chances dead, तब तक आपकी एम्बुलेंस नहीं आने वाली है. थर्ड वाज द आरटी-पीसीआर. सो तब तक अभी आईसीएमआर का जब ये आया है रिकमेंडेशन दैट यू डोंट नीड अ कोविड पॉजिटिव रिपोर्ट टू गेट एडमिटेड. This is come just like a week back. उसके पहले you needed a COVID positive report to even get admission in a hospital. Like it was taking at least 1 week का turnaround time because Goa does not have its own testing lab. So that was the kind of situation. There was no ambulance coming. There was no idea for people at there was no one place to even know कि कहाँ पे bed available है. Like the kind of calls we've gone. Okay, so Goa has a lot of elderly population जिनके बच्चे abroad settled हैं. Right, so now how are you expecting an elderly to like keep calling 104 और आप उस पे कॉल करे जा रहे हो, कॉल लग नहीं रहा है, कॉल लग नहीं रहा है. Then after the petition in the high court they opened up a website जहाँ पे आप beds check कर सकते हो without realizing you are putting aside such a huge chunk of population in the state who does not know how to use internet. How are you expecting an elderly to go on goaonline.gov.in/beds and then find out? And these beds are also like updated, like hospitals are updating it like once in 2 days or something, so it's not even real time data for them. So basically there was no infrastructure to even seek out help for people, and that's when we thought, okay, like initially we started with a Google sheet. Okay, so there are a lot of again elderly who are sick and at home they can't cook, they don't have that sort of energy if they are infected with COVID. Right, so first we got in touch with a few people like some home chefs and some restaurants who could deliver in their 3 to 4 kilometer ka radius, and we compiled a list of them. And the volunteers, like we put up a team of volunteers that would verify every single day. So आज जैसे अगर कोई chef नहीं बना सकती है, like because she has some engagement or he's not able to like get the raw material or something, then we would remove them from the list. Because another thing we realized was, especially for the elderly, it was really really frustrating to keep making phone calls till that one phone call went through from where the help came. So हम लोगों ने एरिया वाइज पहले सबसे पहले तो खाने का प्रॉब्लम सॉल्व किया. सेकंड वाज फार्मेसी, अगेन लाइक ओल्ड पीपल फॉलिंग सिक, हु इज गोइंग टू डिलीवर द मेडिसिन टू देम. And then we got in touch with pharmacies. Also it was very important of to list the pharmacies that had COVID specific medicines. So a lot of them don't have, and you need certain licenses to keep those medicines. So it's become a very holistic resource site for anybody in Goa who is looking for any sort of help, right from oxygen to ambulance to private ambulance. Every single thing is listed. In fact, like unfortunate, like it's quite an unfortunate thing to do, but even 2 days back we had to list the funeral services also, because a lot of young people are losing their parents, parents are losing their young people, and youngsters don't have any idea about how to go about this, right? Like we've never seen dead people and we don't know how to go about funerals. So we even had to list down people who can help you with funeral services. So that's how the situation has been, and it has evolved. And there came a point. This is about 15th of this month. When we realized, okay, like how long can we do this and how much can we do this with no accountability from the government? And that's when like we had to take it to the court because there was no way to communicate with the government otherwise.
Shruti was also one of the volunteers who signaled the SOS from Goa Medical College and Hospital, where between 10 and 13th May, more than 75 people died due to an oxygen supply issue. Since then, the Goa bench of the Bombay High Court heard numerous PILs which threw concern of the state government's handling of the pandemic, including one filed by Shruti, and has directed the state government to ensure that the oxygen requirement of the hospitals are met. According to Shruti, most hospitals are being equipped with their oxygen requirements now. However, there are several medical resources like oxygen concentrators which are lying unused since they have a low flow rate of oxygen.
Yes. So right now, what we are working on. So I think as of now, the government ka oxygen, at least GMC is what I know of. Their oxygen requirement is taken care of after all of this outrage and all of the High Court intervention and everything. Their oxygen crisis is taken care of. In fact, most of the government hospitals have kind of enough oxygen now to not turn away the patients. Now, what we are working on, so right now, individual use of oxygen, individual cell and refilling of oxygen is not allowed in Goa. Yeah, so basically we have put some oxygen concentrators in community circulation. Earlier, हमने पहले जब मंगवाया था, we had got it to give it to the hospitals, but we even figured out that even at GMC there are so many oxygen concentrators that have come from the PM Care Fund and different foundations, and they are all just lying unused because they are not useful for the doctors. They are very low flow oxygen concentrators. The kind of requirements we are getting is either when a patient is not getting a bed, तब तक के लिए उनको स्टेबलाइज करने के लिए जब तक उन्हें ऑक्सीजन बेड नहीं मिल जाता. एंड सेकंड इज फॉर डिस्चार्ज, लाइक अ लॉट ऑफ हॉस्पिटल्स कैन डिस्चार्ज अ लॉट ऑफ पेशेंट्स अ लिटिल अर्लियर. Yeah, so we are also giving oxygen concentrators to those kind of patients so that the load from the hospitals also reduces a bit.
Even as the state is gripped with the second wave, vaccination drives in the state is yet to pick up pace. starting with healthcare workers in the state. Though about 18,000 healthcare workers had registered on the portal, only 10,405 were vaccinated till mid February. As of 19th May, 4,49,802 people have been inoculated in Goa, out of which only 94,422 have received both the doses, which is only 0.06% of the state's population. I asked Dr. Costa on why the state is witnessing such a low number of inoculations. According to him, vaccine hesitancy and the high number of breakthrough infections have made people hesitant from taking the vaccine.
So while before the second wave, vaccine the hesitancy could have been a big problem, I believe it is still to some extent because of the number of people who have gotten sick after taking the vaccine as well. There are no figures. Nobody is wanting to may do a kind of an independent study on this. But there are lots of people who have actually succumbed to the disease post their second jab. Many of them within a week of their first jab as well. Now, having said this, the the other aspect of the vaccination program is that Goa doesn't seem to be on the priority of the national government. We have not been getting enough vaccines. In fact, for the 18 to 45-year-olds, where people are really interested because these are the people who are going out and they want to get a vaccine. Uh, we've not had more than 30,000 or 40,000 vaccines sent for the last. I mean, we are on the 18th. We are supposed to have started 15 days. We don't even have 30, 40,000 vaccines sent. And they're claiming that tomorrow they will have about 30,000. They have not even had 10 or 15,000 done as of yesterday. My own son, I actually did a private vaccine because he's in the hotel industry. I got him to get Covaxin done at the Manipal hospital. He managed to get a lucky for him, he managed to get a slot because those slots open up and they get filled up in less than a minute. So I didn't take mine because I had had COVID in October. It was pretty bad. So for 6 weeks you're not supposed to take it. That was what I was advised. And then post that, when I did my count, I said people who need it should do it, and so I let go my chance, and my antibody count is still high, very high. Having said that, people who have got COVID, it's not an issue, but people who haven't, they're not getting the vaccines that very easily. They were not. Now it is available, and we are not. And Goa doesn't waste vaccines at all. We ensure that it is used well.
Goa on 19th May reported a dip in COVID cases, with just over 1,800 cases reported in the past 24 hours. However, the death count continues to increase, with 45 deaths reported in the past 24 hours, pushing the total toll to 2,197. Even though the case numbers have gone down, Dr. Costa says that people from other states need to understand that Goa is going through a crisis at the moment. Resources are stretched and the healthcare workers are exhausted. He appeals that the state requires some time to heal from this crisis and will open its doors again once it's ready.
What we want people to understand is that, listen, we are having our challenges because our health system is really stretched. Everyone is tired. We just want people to relax and let go or heal a little. That's what I'm requesting, because people still think that they can come here and party. We need this thing to kind of cool off a little bit, because we the one reason why we are not in a position to get our COVID care center started is because we don't have staff, we don't have nurses, we don't have doctors who can go out there. Everyone is stretched, and there are a lot of doctors who are sick themselves and they can't actually go out, and so therefore there is a huge problem with staff. It's not just facilities. I didn't mention that earlier. We are having a tough time getting our teams up and running because they are really exhausted. So we request, though we are the party captain, we'd love to host you. Let us get over this pandemic first, and even if the government opens up, just be a little wary about coming for the next 6 months at least, because we want to kind of get over the third wave at least before we can open up fully.
If you liked listening to this episode, please subscribe to The Big Story for episodic updates. We're available on Apple, Google Podcasts, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website, and for any feedback, please shoot an email to podcast@thequint.com.
Thanks for listening. Log on to the Quint website and check out our other podcasts.